Okay, good afternoon. My name's Alan. I'm your student physical therapist for today. So I saw we had some wrist pain. Hey, no, it's mostly on the left. Do you have any pain in the right wrist?
No, just the left.
Okay. Are you able to point towards it for me?
Yeah, it's kind of just like here.
Okay. And then I read in your referral or your intro sheets that it's been about 3 months that you've had it, right?
Yes.
Perfect. Are you having any numbness and tingling with that?
No.
No numbness and tingling. That sounds perfect. Any neck pain?
No.
Perfect. So, can I have you just have your hand rest on the table? Do you do anything that makes it feel worse?
Yes. Things that make it worse are typing, writing. I'm holding my cup of coffee in the morning, and then just kind of like opening or trying to just do opening containers of plain space.
And and then anything that makes it feel better? Sorry, I'm taking that.
Right, you're good. You're good. Just not doing that stuff makes it feel better.
And then I'm just gonna move on to looking at it. So we're gonna see if there's any noticeable swelling, any redness.
There's mild swelling over the tendon, mild swelling and tendon over the distal radius.
I can try, but.
You said distal radius or tendon?
Distal radius.
Okay. Okay, let me just go, I'm just gonna put my hands, I'm just gonna start at your elbow. Any pain up here?
No.
My phone going down lower.
Yeah, little tendon.
Any over here where my phone is, right?
Yeah.
Any pain down here?
Yeah, little tendon there.
Okay. How about right about there?
Yeah, a little
There, okay. I'm gonna flip it over just to feel how it's going. Make sure everything's okay on the inside. Anything on the inside?
No, nothing.
Maybe a little bit faster because it seems like it's all good.
No issue there.
And then I'm gonna do some little movements. So you do some movements. Are you able to put your thumb to your pinky?
Yes.
Perfect. Can you do it on the other hand too? Okay. So this one's a little bit removed.
Yeah, it's because it's painful.
Okay. Can I have you go ahead and pinch? So pinch your fingers. I'm gonna go ahead and pull. Was that painful?
Yes.
I'm gonna try the other one. Okay. Okay. I'm just gonna check your movement really quick. Can I have your head scoot up a little bit so that your wrist is over the table? I'm gonna have you try and pull your knuckles towards the sky. Any pain?
No pain.
Alright, I'm gonna give it a little push. Any pain?
No pain.
So check. Hold it there, hold it there. Relax.
It should be 60. Pass it. I'll just hold it.
I'm gonna do it again actively real quick. Grab and measure that.
And then it should be 45.
You said 60 for passes?
Yes.
I wrote down the actual number. Now go ahead, just there. Go ahead and keep your fingers extended and pull your palm down, point them towards the floor.
This should be 50.
You actually have 50.
Oh, nice.
Then pass it.
And then 70.
You have both. For this, so scoot your hand back just a little bit. Can I have you pull like your pinkies out? So like your whole wrist, can you pull it out with this?
Go this way. Okay. And it should be 30 degrees. And then it doesn't go any further.
Okay. And then go ahead and do the other direction. and go towards your thumb. All right, can you do that?
Yeah.
Really good.
Should be 10.
Then probably has
Goes to 20
okay.
for passive.
Everything looks pretty good. A little bit lower than it should, but not too bad. With the thumb, I'm having it here. Or the thumbs up. And I'm going to put my hand here. What I want you to do is, can I have you try and pull your thumb away as far as you can from your other fingers?
So it should be 25.
And
It doesn't go any further.
can I have you try and pull your thumb into your palm?
Should be 10.
So a 35 excursion. And then go ahead now, palm here. Can I have you go ahead and put this. Can I have you pull your thumb as close as you can to your pointer finger? Perfect. Is that all the way out?
And it should be 25. I missed it, but there should have been painted in range with the CMC flexion.
Okay.
I missed that. I was reading the wrong part.
So that was 25 excursion then for the thumb?
Yeah.
Okay. Good. We're gonna check your muscles, so go and pull your hand out all the way again. And go ahead and try and extend your wrist. Wrist up towards the sky. I'm just gonna push down, okay? Good. How'd that feel?
No pain.
Good. You're supposed to give me a grade or is that? That's what I
Yeah,
did?
just the 3.
Go ahead, palm up. Try and make a curl. Focus. Good. And then. Anything with that?
No.
Okay. I'm gonna go this way, so I want you to try and pull your thumb towards the sky.
Oof.
That was pain.
Yeah.
And then we're gonna go here. Go ahead and try and pull your thumb towards, or your pinky towards. Good. Anything?
No.
Can I have you have your wrist here? I'm gonna have you try and pull your thumb out towards me, or out towards you.
Up towards me.
Good. Then hold that. Okay. Painful.
Yeah.
And then try and pull your thumb across your finger. And I'm just gonna give it a little push. So painful.
Yeah.
I'm gonna check your grip strength before we move on any further.
Okay.
Go ahead, I want you to scoot out just a little bit from the table. And on that left arm, I want you to hold it here, tucking your elbow into your side, and then squeeze as hard as you can. 1, 2, 3, relax. It's horrible. And we're doing the other side, so we have to check bilaterally to check to see if there's any difference between the left and right arm. And I will clear the left arm in a minute. Squeeze, 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 squeeze. A lot stronger on that side. I'm gonna do it 2 more times. On this side.
Did not reset.
I did not. nerdy do that, but, go and back into the table. Pain on the thumb, just to clear this arm, or I'll clear the elbow really quick. I know we're jumping around, but I wanna make sure the elbow is at least okay too. So go and bend your elbow. Good, go and push away, walk all the way out. Good, one more time. Just go and hold that. Hold. Good, go and push me away. Good. You check this side of the wrist, go ahead and turn around. Since we're comparing wrists, I do want to check the other wrist to see how it changes between wrists. So go ahead and push on the table. Go ahead and push up, push down. So one more time. Relax. That's okay. Press down. I'm going to say rest in. Trying to pull your thumb in. Relax. Good. Thumb out. Yep. Good. Looks like that right arm, right wrist is all within normal range. I have you pinch up, pinky to thumb. Good. I go pinky to finger. Good. Good. So a lot stronger. I already did that earlier, but I'll be sure. So yeah, right side looks very good, very clear. It's that left side that we're worried about. Check. Also be back so that we can actually work on that left hand again.
That's good.
Okay. Go ahead and scoot your hand forward. So we're going to do some special tests to rule in and rule out other diagnoses. The first one we're going to do is a UCL tear. So we're going to rule out the tear of the ligament here, just in case. Stress. Is there any pain with that?
No.
Okay. I'm going to go ahead and give a little distraction. See how it feels. And a little compression. Nothing.
Okay.
Now we're going to do the specific test for the type of what I think you actually have. I want you to put your thumb inside of your hand. Actually, don't. I'm going to have you have your hand here. I want you to try and push your fingers towards the floor. Perfect. I'm going to give a little pressure. Is there any pain? And let me know when any pain starts. And then I'm going to push your thumb into that.
Pain there.
Okay. Now I want you to go and put your thumb inside your hand. Just relax. I'm just going to go and give a little
Pain there.
perfect. Sorry about the pain.
No worries. I understand the process.
Now I want you to put your palm down. And I want you to try and push your fingers towards your palm. Try and push your whole palm down. And try and push your thumb away. And I'm going to give a little pressure, okay? Is that painful?
No.
Ah.
I would assume.
Okay. So it seems like we're having a little bit of maybe it's possible that we have some deeper veins, which is the tenosynovitis inflammation of the thumb, abductor brevis, and extensor brevis. So we're having some pain with that, which means it's kind of inflamed. It's the tendon sheath. So what we do for that is we're going to treat it with some stretching, some mobilization, all types of movements that will allow you to get back that strength that you want to go back to working. So what we're going to do is we're going to actually start with some cross friction massage and soft tissue. So all I'm going to do is I'm going to put you into a slight stretch. I'm going to go, and let me know when it's the most tender. Right there.
It's a little bit low. Yeah, right there.
So I'm just going to put you in a little bit of a stretch. I'm just going to cross friction. We're going to do this for 30 seconds until moderate pain. It aggravates a little bit because we're activating the mechanoreceptors of the actual tendon sheath, which causes that extra inflammation, but it does increase wound healing, or well, scar tissue, and it breaks up the tendon sheath a little bit so that it can heal more properly.
Well, it hurts.
Yeah. So we're gonna do it for 30 seconds. We're gonna do it 3 times. We can do it at most to 5 minutes. We'll do it 3 times today. 3 seconds. Perfect. So now that we've aggravated a little bit, and we're actually just gonna do a little bit of a stretch. So I'm gonna do it manually. So stretch you. I'm gonna hold your hand out here. So we're actually gonna do into a little abduction, like that test. But I'm just gonna hold you there into a little bit aggravating position. So we're not going to aggravate it too much, but you need to have that little stretch of the tendon. And then hold it there for 30 seconds. And now we're going to strengthen. So we want to strengthen all the muscles around it so that the wrist can activate and function properly.
Okay.
So what we'll do in clinic is we'll do some PNF and we're gonna do some. So we're gonna try and get our wrist up. And I'm going to, at the top I'm gonna push, and then when you go down, I'm gonna go down. So I'm gonna push here, so pull up, strong, 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 strong. Good, and then down, 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 up. Good. So these are for the two sides muscles. They're the muscles that do this motion. And then we'll work on the muscles that flex and extend your wrists, the ones that bend them.
Okay.
We're gonna do 3 sets of 10. Increasing that muscle strength and blood flow to the tissues. Go ahead and palm up. Actually, we're going to do palm down. And then go ahead and make a fist. Now try and pull your palm. Good. Hold. And try and slowly relax. Good. And then go ahead and push, 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 push. Good. And push up towards you. Now I'm going to slowly break you. So we're going to do eccentrics for this one, okay? And then I'm going to slowly break you. Slowly push through, strengthening those muscles. Good. Slowly. Good. Again, 3 sets of 10, just strengthening those muscles. Good. And for home, because it is an inflammatory sort of tissue, we can have a night splint inside of a little bit of a neutral wrist, and you can use the splint at night for painful nights or most nights. And it's called like a thumb spica, so it's going to wrap around the thumb and hold you about in a little bit of extension and abduction. And then we're going to have stretching at home. So when you're at home, I just want you to lightly do the test. So thumb inside the finger, then basically glide through and then pull back. So once you feel that slight pulling, just glide into it. And this is more of a glide than a stretch. It's trying to moving that tendon through the sheath, relaxing the inflammation, slowly working that blood into it. Okay? Now I'm going to be a sort of a 2-second hold at the end. We're going to do that for 3 sets of 10 as well. And then we can test your hand strength because we did do some cross friction, which might have activated the mechanoreceptors. We did do some strength assessment. So we can test strength again. So on our left hand, we'll just do 1 measurement of strength for your feet pose. See if we have any increase in strength in the treatment.